Diabetes is an epidemic within Black, Latino, and Native American communities. It is wrecking the lives of families and placing a burden on our healthcare system due to poorly managed diabetes. We are committed to doing something about this and helping patients with type 2 diabetes better manage their glucose and their diabetes. But first, we must understand what is type 2 diabetes. So type 2 diabetes is when the body either is resistant, becomes resistant to the insulin that a person is making on their own, or the pancreas, which is the organ that produces insulin, is not able to produce insulin as well as it should. For some people, they have a combination of both. Anytime a person is not able to process the sugar inside of their body as well as they should, this is called diabetes. So there's several risk factors that we look for when concerning prediabetes or diabetes. One is, does the person have a family history of diabetes? Anybody in their family, especially under the age of 50, a younger person being diagnosed with diabetes? That's a question that we ask. With a family history, we always want to say, keep in mind, most of the time with families, there's a trend. So are you eating the same foods that your parents ate when they were diagnosed with diabetes? So food is a big factor that can really influence diabetes. And so we ask patients to look at that. Look at your lifestyle. Look at the foods you're eating. Look at how active or maybe sometimes inactive you are, because those are things that can really make an overall impact, not just on diabetes, but on our health overall. Next thing, a risk factor. As a woman, have you been diagnosed with gestational diabetes during a pregnancy? So anytime a woman is diagnosed with gestational diabetes, that significantly increases her chances of being diagnosed with diabetes long after that pregnancy is over. Sometimes it can be 10, 15 years after a pregnancy that she had gestational diabetes and finds out later on that she has non-gestational or regular diabetes later on in life. So that is definitely a risk factor. Do you feel thirsty all the time? Do you feel like you are constantly needing something to drink? Are you noticing that you're going to the restroom a lot more than you previously did? Do you notice that you're eating more than you previously did, or just has somebody told you like, hey, you're eating a lot more than you used to? All of those combined kind of give us a flag that says, hey, maybe we need to look towards and check their glucose, check their sugars. Another risk factor is kind of go hand in hand. If you have high blood pressure. So high blood pressure and diabetes, for many people, we see them together. So what is an A1C? And an A1C is basically everything you eat leaves like a sugar trail on your blood, and that A1C allows us to go back and look at that sugar trail for the last 3 months and gives us an average of what your glucose has been for the past 3 months. Depending on what that number is and where it ranges, lets us know, are you normal, are you fine, are you pre-diabetic, or are you diabetic? And then from there, depending on what those values are, we speak to our patients and we help make a plan for them. So some signs that the body produces to alert us that our glucose may be significantly elevated at whatever time you and your doctor have determined how frequently you need to check your glucose. But you may experience things like dizziness. You may experience feeling like you're just really fatigued, you don't have any energy. And that, for a lot of people, is the first sign that, hey, my sugar is really, really elevated and something's not right. For some people, if they've had elevated glucose for some, it may be an extended amount of time, it may be a short amount of time. For others, the body starts trying to process that excess sugar in different ways. And in one of those ways, the byproduct of that process may cause the person to feel like they're imbalanced, to feel like they're, the best description patients say is like they just feel like they're kind of drunk and just things aren't right. And that lets us know the body is in overload for the amount of sugar that it's trying to handle and it's trying to process, and it's too much for it, and it's trying to do whatever it can. Another thing, are you experiencing numbness in your fingers and your toes? So diabetes attacks the smallest things first, and one of those smallest things are the nerves. So some patients say they experience numbness, some people say tingling, some people describe it as like pins and needles, some people say it feels like little ant bites. But if you get that sensation, that lets us know, hey, this person has had an elevated glucose for usually quite an extended period of time, and now they're getting damage to their nerves. Another one, which is why we tell patients always go to the eye doctor at least once a year. Patients that have diabetes have to take a special eye exam, and it's called a diabetic eye exam, and we really want that to happen once a year, because what's another small thing in the body? Blood vessels. The smaller they get, the sooner they may be affected by diabetes. And what's one of the smallest places we have? The vessels in the eyes. The only people who can really get a good vision of those vessels and see what's going on and make sure they're still healthy is an ophthalmologist. That's just a specialty eye doctor. And so if you have diabetes, you want to be sure that you are going and getting your eye exam annually, because the worst thing that can happen, and sadly there are many patients that suffer from this, is blindness due to diabetes. It's something that if we can catch early, we can do our best to prevent. It is something that doesn't have to happen, but you as a patient have to make sure that you go into your appointments, you get seen, and most of all, you manage that glucose, whether that be with diet and exercise, whether that be with taking your medication as you should.